Record,
Uh,
instructor.
all right, so now we're going to talk about chapter 2, workforce safety and wellness. There's going to be a lot of things that go into this, how to keep yourself safe, things that are going to go into some aspects you might not have thought about getting into this career, this field, dealing with the things that we deal both physically and emotionally. So again, this kind of wraps up everything we're going to talk about. Okay, so guys, EMS, healthcare in general, but especially EMS, it's very taxing, all right, both physically and mentally. It can take a toll, especially physically. A lot of people aren't prepared to go out there and lift up these patients, to carry the equipment that we carry, go up and down stairs, all that stuff, and especially the emotional part. So we're going to talk about different ways to kind of prep and deal with both aspects of that. You typically, you hear people say that, healthcare providers are the worst patients, especially people in EMS, right? We don't really keep our well-being on the front burner, if you will. We might feel sick or we might be injured and we just kind of put it off and we put it off. We don't do these things. That would ideally make it easier to take care of ourselves physically and mentally. So we'll talk about some of that. Here's your hallmark definition of what wellness is. All right, so mental, physical, and social well-being. Sounds cheesy, but it is true. All three of those parts have to be taken care of and have to be in good health to make sure that you're rounded, A, as a person, and B, as a healthcare provider, okay? You gotta be happy at home and you gotta be happy at work too, because if you're unhappy in either one, it's gonna reflect on the other. Guys, I'm not saying that you can't have a bad day. I'm not saying that you can't have crap going on in your life, but just make sure that you are doing a self-check as to what your attitude is towards these patients that you go on scene for, towards your partner, because you might not even realize that you're being Oscar the Grouch, all right? You might have an attitude or you might be snippy and you're just blind to it because that's your state of mind. But just make sure, your tone of voice, the way that your body language is. If you're having a bad day, your patient is none the wiser about it, and nor do they really care. They don't want you being a jerk to them just because you're having a bad day. So try your best to kind of leave that bad personal stuff at the door, at least for the duration of the contact with these patients. Because again, if we're not tactful, if we're not compassionate, then it's just going to overall ruin the relationship we have with the patient care, all of that stuff. Okay. So guys, make sure we protect ourselves from disease and hazards to make sure we're physically well, right? How do we do that? PPE, personal protective equipment, right? Gloves, bare minimum. Guys, we'll get into this. You don't know these patients from Adam. You don't know where they've been, who they've come in contact with, what they've touched. So bare minimum, the minimum PPE you need to have on for every patient contact is going to be gloves. All right, there's other forms of PPE, but yeah, definitely do that. What else? Okay, so being aware of your surroundings. If we have some type of exposure we can avoid, absolutely. What else?
Make sure you're communicating with your partner at all times, because a lot of times injuries can result from that.
Okay, yes. But what about protection from disease?
Face
Oh,
mask.
from disease?
PPE, do what?
Face mask.
Face mask, so that's another form of PPE. What about your immunizations? Right? Making sure that you're getting your immunizations, making sure you're washing your hands, making sure you're using hand sanitizer, all of that stuff, okay? Proper nutrition, this is a lot easier said than done, especially in EMS, because we will talk about it. We have, they say the freshman 15, that first year of college, because you're just like eating out junk food, you don't have a normal routine. That's kind of like the same thing in EMS, all right? Especially at Grady, we work based off of a post system and not a station system. If you don't bring your lunch, whatever you're going to eat that day is the fast food place wherever you're posted whenever you're hungry. And you can't really control the health content of the food at those fast food places. So as best as you can, we'll talk about that. Guys, exercise, sleep as much as you can. You know, y'all know your bodies better than anybody. Okay, if you know you're reaching the point where you're starting to become stressed, you're not able to handle stuff as well, y'all all need to think, right? Whether it's going to the gym, going for a hike, playing music, video games, whatever it is that's kind of like your mental escape or to allow you to kind of decompress all that stress, you gotta find a thing. Because I guarantee you, at some point during your career in healthcare or EMS, you are going to reach that level where you've got to go do your thing and de-stress, or you're gonna reach a breaking point. So if anything you get from this course, have some self-reflection time, figure out what your thing is so you know, hey, all right, I'm getting to the point where I'm getting really irritable. I might snap on somebody. I might have a little bit of a breakdown. Know what your thing is so you can kind of avoid getting to that point. Sleep as much as you can. If you have children or other crazy work schedules, I know that's easier said than done, but as best as you can, get sleep. Refrain from tobacco, drugs, and alcohol. Okay, drugs, hard no. All right, the illicit, the illegal stuff, definitely don't use that stuff. It's funny that they say to refrain from tobacco and alcohol, because usually you see people in EMS increase tobacco and alcohol kind of as a coping mechanism or just the new normal. So everything in moderation, okay? Taking time to relax if you have that additional time. Like I said, find your thing, carve out some of that time or some of your day to make sure you can do your thing before you reach that breaking point.
Dr. A,
Yes.
what's the what causes so much stress and from your perspective, you know, psychological? Like, what is causing all of this breaking down and, you know, that you're describing right now?
So there's a lot that goes into it. When you first start out, some of these things won't get to you as much. When you first start out, y'all are probably, and I'm not saying I'm not breaking your spirit right now, but when you first start out, it's if you catch a late call, it might be okay because you're really excited still about going out and doing these things. And if you have, you know, a work day that goes an hour or two over, it's no big deal because it hasn't happened a lot yet. If you work with, let's say, a terrible partner or just, you know, somebody who is just sour about everything, you might say, okay, whatever, that's your prerogative, and not let it get to you. Just a lot of repetition, seeing really bad living conditions that these patients live in, visual trauma, like if you have like a pediatric cardiac arrest or you're seeing brain matter all over the road, you know, it starts to get to you after a while, especially in an area like Grady that has a high call volume. A lot of the times you don't ever get a break. You're running a call, you're going back into service, and somebody else is called and you're the only available ambulance and you're literally going all day long. So it just, over the course of time, it just builds and builds and builds. And it just, you start to get a little, maybe a little disgruntled is the best word, but it's over time, it'll start kind of weighing on you. Or you might be Gandhi and none of this will ever bother you ever, and that's great. But this is just a realistic chapter to introduce you to certain things that might start to become stressors for you.
Understood. Yep.
Yep. So again, guys, more roles as an EMT, you got to be prepared, right? You got to know your protocols. You got to know. So if you get dispatched to a triple shooting or a cardiac arrest or a pediatric really sick kid, guys, that's nothing anybody wants, I promise you. But you need to know exactly what you're supposed to do so you're more prepared when you get on scene. You already got it in your head, you know those protocols, and you can deal with it if things are kind of taking a variance when we get on scene. Anticipate needed resources. Again, know your limits. Know your physical limits if you're not going to be able to handle picking up a patient. Know your scope limits if you need to call ALS. Because guys, if you're a BLS crew and you're responding to, let's say, a GSW, what we call central wounds, they've been shot in the chest or the stomach, there's a lot of vital organs in there that can cause them to die quickly. go ahead and say, hey, we will absolutely respond to this unit, but you probably want to go ahead and get ALS en route, just so we have that resource available, right? So know your boundaries, control the scene and care for your patient, okay? This is really important. Your calm manner will calm patient bystanders and family members, okay? To a certain extent, you are going to set the tone for your scene, right? Remember we talked about earlier, if you get off that ambulance and you've got that deer in the headlights, you're stumbling over everything, you're freaking out, everybody else, the patient, the family members, bystanders, they're going to pick up on that and they're going to freak out even more because they're like, oh crap, my loved one's not in good hands, right? So all of the anxiety, the chaos, all of that's going to go through the roof. But if you step out of that truck, you might be screaming on the inside, right? Like, oh my God, what am I doing? I don't know how to handle this. I've never ran this call before. But if you're, moving in a slow, like a calm manner, everybody is going to say, oh, they're going to be none the wiser that it's your first day in your first cardiac arrest. If you are acting like you own that scene. Because what are they going to think? Oh, you know your crap inside and out, right? If you act like this is the 27th cardiac arrest that you've ran, everybody else is going to think that you've got it under control and there's not as much reason for them to freak out. Okay, because guys, that fear, that panic, that hysteria, it is just a ripple effect. If one person's freaking out, it's just a mass. People start picking up on that environment, on those emotions, and it can become a mob mentality before you know it, okay? So just make sure as best as you can to physically, externally, be as calm as possible so other people are picking up on that. Be like, okay, they're not acting like they're freaking out, so maybe it's not that big of a deal, so maybe I can calm down, all right? So stress, again, guys, who does not know what stress is? Number one, I hate to. But everybody knows what stress is, right? You just get to you have anxiety, you've got some anticipation about stuff, you've got things that make your heart rate increase, things that make you nervous, all right? Or things that are just piling on top of you, like paying bills, making people happy, having time to relax, all of that stuff. Everyone's aware of what stress is. And like I said, hopefully at this point in your lives, you can recognize when you're becoming stressed out. It's really important that you're taking that step back and be like, oh yeah, I have been like biting people's heads off and just not being pleasant. Maybe I do need to like take a step back and maybe, take a shift off of work, or maybe, plan a camping trip, or whatever it is that you guys need to do to kind of bring that level back down. But it doesn't matter how bad of a day you've had. It doesn't matter how stressed out you are at home or at work. These three things should never waver, okay? Your personal safety, again, that is always, always, always ultimate number one concern. You can get tunnel vision if you're angry or irritable or stressed out and not realize that there's somebody standing on your scene with a gun, okay? So make sure your scene safety is always number one. Make sure you're watching out for your partner's safety, right? The safety of your patient. The safety of anybody involved in this patient care, and that you're doing the right thing by your patient. You're not missing any part of your assessment because you're stressed out and you just want this call to be over. All right, you got to make sure that you do a thorough assessment every time, because the one time you say, oh, whatever, I'm having a bad day, I don't feel like checking the blood sugar, it's going to be way high or way low, and you're going to miss something. Okay, so just make sure you need to take a deep breath. Even if you're having a bad day or you're stressed out, don't let this patient suffer because of your emotional level, okay? So, ways to manage stress. If possible, go ahead. If possible, minimize or eliminate stressors. Guys, again, that's easier said than done. You can't come and work a 911 shift in Atlanta at Grady and be like, okay, diabetic calls stress me out, so I'm not gonna have any diabetic calls today. That's not how that works, right? When you get dispatched to a call, you have no idea what it's gonna be. Based on where you are in location to that call and what your level of care is, you get whatever comes your way, You can't pick and choose what call you take and what call you pass on, okay? Change partners to avoid a negative, hostile personality. Guys, partners can make or break your experience in EMS. If you have a great partner who is just in a good mood all the time, has really good patient rapport, and all of this stuff, it will just make your day go by so much faster. It'll make your calls much more fun. You know, you can actually sit back and have conversations, pleasant conversations with these partners when you're not running calls. It's great when you have a great partner.
Probably a dumb question, but like, what is partners? How does that work?
So if you're full-time, if you have a full-time partner, that's the same person you work with every shift.
Okay.
So you guys are together on the truck for 13 hours a day, minimum. Yeah. So you see why if you have a good partner, it really, really helps the situation. On the other hand, if you have a really bad partner, just somebody who, let's say, has been in EMS 10 years and they're just burnt out, what we call burnout. They're just tired of it. Their lack of compassion. They're just, you know, bad mood, negative Nancy all the time, guys, that can bring you down. As good as as positive as your personality is, if you're around that for 13 hours a day, 3 days a week, it'll start tearing down your spirit. All right. So if that's a problem, if you are just not getting along with your partner, if they are not conducive to a positive work environment, you can attempt to follow the chain of command first, right? Sit your partner down and be like, hey, what is up, man? You just, you know, you don't want to run any of these calls. You've got an attitude the whole time, because you can have a conversation without it being an argument, right? So try to talk to your partner first. Maybe they're at that place where they don't even realize that they're projecting that negativity. And maybe they can say, oh, sorry, I didn't notice it. And they can do some self-reflection. If that doesn't work, you can attempt to talk to supervision or HR and say, hey, is there any way I can do like a partner swap? That is easier said than done. You can't just walk into the office and be like, hey, you know, I don't really like my partner. Can I get a new one? They don't usually say, yeah, sure, no problem. Let's swap it up. Because we're usually short-staffed. They have the trucks pieced together by scope for logistical purposes. So, but that's something to consider if that's really bringing down on your mental health.
What's the typical work schedule like? Or full-time schedule, I should say. I guess full-time and part.
Yeah, so usually if you're full-time, you work 3 days a week. More often than not, they're consecutive days. And they're slotted to be 13-hour shifts by the time you clock in and clock out. So that way you're as close to 40 hours weekly as possible. Bare minimum, they're 13-hour shifts. Sometimes they can go excessively over, but usually it's 3 days a week for 13-hour shifts on the truck.
What about part-time?
Part-time, it just depends. I think with Grady, you just have to work 24 hours a week. So you could pick up 2 shifts, either consecutive or spaced them apart. We do have a couple of shifts here at Grady that are 4 10-hour shifts a day. So you work 4 days a week instead of 3 shifts. But it's just, that is a benefit for EMS and healthcare, that you don't have to work 9 to 5, 5 days a week. You can have extra days off.
Is there overtime? Do people do overtime?
Oh, yeah.
Okay.
You also get paid more if you work night shifts, and you get paid more if you work weekends. So if you don't have any other plans or commitments or anything, and you work a weekend night shift, you can make significant amount more than like a Monday, Tuesday, Wednesday.
Like you're going to college like Tuesday, Thursday, you could work like Friday, Saturday, Sunday.
Yeah.
Get paid, like,
Change work hours. This is, again, easier said than done. If you're, question or stretching? Question, go ahead.
Is it feasible to like only work through the something like that?
Maybe, like how,
Didn't hear what he.
like months?
Whenever it's not. Whenever there's no snow, and there is snow. Like I work sometimes.
I mean, if it's consecutive months, then yeah, that would probably be feasible. But if it's only like a couple weeks window, yeah, that would be feasible.
What was the question?
If it's possible to work like seasonal, I guess would be the best way to put it. Like if you work a job somewhere else in the country at different times of the year.
I see. I see.
So change your work hours. Again, guys, when you first start out working 911, you're going to get the least desirable shifts. It's just based on seniority. The longer you're at an agency, the more weight you pull when you say, hey, I really don't want to work weekends anymore, or I don't want to work night shift anymore. You kind of got to put in some time before you can be picky choosy about, you know, the ideal or the non-ideal shifts. So if you are working night shift and that's really like throwing your whole Zen out of whack, after a certain time frame, you could ask HR or scheduling if they have anything else that's not night shift. But again, it's not always just a quick fix when it comes to those things.
Is it feasible to like work around the school schedule? Because I'm a full-time student as well.
Usually, if you're like a part-time employee or what we call a PRN employee, if you're a full-time employee, you have to work the same days every week. But you have some flexibility to work different days if you're not full-time. So, yeah.
You get to choose the days that you work.
Typically, if you're PRN, yes, you do. But I can't 100% answer the part-time. But I know full-time, you're a set designated schedule every week. Change your work environment. Guys, this is the easiest one. Your day is going to be as bad as you set your mind to it, right? Like if you just you're irritated, you didn't get sleep, your coffee hadn't kicked in, and you're just going to be pissy no matter what, you're going to have a bad day, right? But if you get on the truck and you're like, okay, you know, it's only a 13-hour shift, we can handle whatever for 13 hours, and you have a positive view on this stuff. I'm not trying to act like or sound like a Hallmark card or anything like that, but that was a life-changing thing for me, right? If I'm going to be negative and pessimistic, you get what you give. Like if you're putting those vibes out there, people are going to pick up that you're being pissy. Well, excuse me, and they're going to be the same way towards you. But if you're nice, you're positive, you're happy to be there, people are going to pick up on that and they're going to be positive towards you. So that's the biggest thing that you can control. Everything else is pretty much out of your hands to a certain extent. Okay. Cut back on overtime, guys. If you're working 5 days a week, right, you know, back to back to back to back, yeah, that's going to be a good paycheck, but you got to get some time to chill out. Because 5 days a week, it doesn't sound that bad if you're doing like a bank schedule, right? 9 to 5, an office job. That's not that hard, but this is not an office job. All right. Again, it's physically and mentally tasking. That's why it's typically only a 3-day work week when it comes to EMS and healthcare. Okay. Again, change your attitude about the stressor. Talk about your feelings, guys. This is a big one. This is again where we are evolving as EMS and healthcare. Again, we have some of the same attributes as military mindset. All right, it used to be that in EMS and healthcare and in the armed services, you can't have feelings. It's not okay to be sad about something. It's not okay to be upset about something. And if you are, you better not show it. All right. The whole tough mentality used to be the only thing acceptable. That's changing. Guys, I will say you have to have somewhat of a harder exterior to be able to handle just some of the stuff that we see, some of the things that we hear, the sights, the smells. Things are going to stick with you for a very long time and they can mess with you. All right. But is anybody familiar with the Code Green campaign for first responders, for military? Just that new mentality that, guys, it's okay to talk to people about this stuff. It's okay to let somebody know how bad that call messed you up and how you still hear, you know, whatever that patient was saying, or you still see that patient laying there dead, or whatever it might be. It's okay for it to bother you. You've got to let these things out. If you don't talk about it, because I'm not saying you got to go to like group therapy or get a therapist or anything like that, but find your person. All right, whether that's your significant other, whether that's your partner. All right, find your person that you can vent to and get it off your chest. Because if you don't, it's going to bottle up and it's never going to have a positive outcome if you let it get to that point. All right. Within the past, I think it was a year and a half, or 2 years ago, we had a medic at Grady take his own life because of PTSD from everything that they saw. Guys, you hear about this a lot more. All right, first responders, military, veterans, okay? This is changing. If you see something that bothers you, get it off your chest, okay? I don't care how you get it off your chest. Find your person, have your time to de-stress, but you got to deal with the feelings before they bottle up, and it's not good outcome for anybody, okay? So if you need therapy, go to therapy. You know, it's not a taboo thing anymore for somebody to say, hey, I talked to my therapist, or I had therapy session. It's pretty common for people to do these days. These two guys, you're not going to be able to change a lot about your job in healthcare. You're not going to be able to change the call that you get dispatched to. You're not going to be able to change the underlying problem with your patient to, you know, a certain extent. But again, it's going to be as horrible or as frustrating or as negative as you make it out to be. If you know, try to have a silver lining outcome, or say, okay, you know, there's a reason I got this call or that I have this patient, it can really, really help make these things a lot lighter, and it won't weigh you down as much, okay? So again, expand your social support system, develop friends and interests outside of EMS. Guys, it is awesome if you're passionate about your job, right? But this does not need to be everything that you eat, sleep, breathe, right? You've got to have something outside of this. You've got to have a hobby. You've got to have a friend who has no idea what you're talking about when you use your medical terminology, because if this is all that you do day in and day out, you don't do anything but work or go to conferences or read up on all of the new research. Those are good things to do in moderation. But if this is your entire life, it's gonna become too much at some point. All right, so make sure you have some friends, a support system that aren't in EMS, so you can just have a little mental break, physical break. You need it. All right, on that same token, it's really, really good to get friends that are in EMS, right? Hopefully you and your partner get a good relationship and you guys can talk about things. But why do you need to have friends within EMS? Why is that going to be beneficial? They understand, right? Both literally, when you're talking med term, if I went up to one of my girlfriends, she has no clue about medicine. She hates blood, all of that stuff. She only watches Grey's Anatomy because it's like the drama and the romance in it. If I go up to her and be like, dude, we had this AMS patient we got on scene. He was ANO ×2. His GCS was a 10. His BGL was a 20. We had to give him, an AMPA D50. His pulse ox was like, 70. So we had to bag him. She's going to be like, English, please. She's not literally going to understand anything I'm saying. But then also, what is she not going to understand? If I have that pediatric cardiac arrest, she's not going to understand what?
Can't understand all the emotions.
She
What you
can't
went
fathom what's involved in something like that, right? Visibly seeing this kid laying there dead, hearing the parents, crying and realizing that their kid's gone. Like, that's heavy stuff. Unless you've been there, done that, ran that call, you're not going to get it. All right? They might be there and be a good listener and you can dump all of this stuff on them, but getting somebody in EMS, they're going to have run that call, obviously maybe not exactly with you, but something to that capacity. They're going to get it. All right? They might understand that you just need to dump and they're just going to sit there and let you dump. They might not try to Dr. Phil it and say all these magic words to try to fix things. They'll understand what you need because they've done it. They've been there. Okay? So just have a good balance inside and out. EMS, sure, all of this sounds great on paper. If you have time to practice yoga or meditate or slow, deep breathing, physical exercise, guys, again, yes, if you stay physically fit, it is physically easier on your body, you feel overall better. But we know that, if you've got kids, if you've got another job, some of that's not feasible. So again, find your thing. Try to make sure you take time for your thing. Limit intake of caffeine, alcohol, and tobacco. again, EMS usually makes you go that way with this stuff. Guys, in moderation, again, everything in moderation. If you need your coffee to get you started in the day, that's fine. If you need a Monster to have a pick-me-up in the middle of the day, great. Do not slam 7 Monsters back to back. Not good. All right. It might be easy to do if you're working a night shift and this is your 5th shift in a row, right? But that's not going to be good on your physical well-being, and it's going to make you think jacked up on Mountain Dew thoughts, and your patient care might reflect that, right? Alcohol, definitely hard no on the job for this, right? Also be mindful of how much you drink before you have to come to work, because we may or may not have somebody been fired because they came in hungover / still drunk from a bender the night before. Not okay. All right. A, you're providing patient care. You can kill people. And B, you're also driving. So again, killing people. All right. Tobacco. If you don't smoke, you might pick up smoking. It's like a clique in EMS. You got like the smokers and the non-smokers. Or if you only smoke like half a pack a day, you might go up to 3 packs a day. Take a second to step back, have some self-reflection to see if those habits are kind of getting a little out of control, okay? Because guys, if you're a smoker, that might be your vice, right? That might be what you need to take the edge off. And if you need to take the edge off, that's okay, but just keep your health in mind too. And also too, what about if you are a smoker? Because technically you can smoke on the job, but what's something you need to think about? Okay, so if you have an asthmatic patient, you're at post, you're catching the smoke, and then you get a call for code 1 difficulty breathing, which means life threat, lights and sirens, and you go and it's an asthma patient who's triggered by cigarette smoke, and you reek of cigarette smoke. That's something to think about, right? You can cause issues with your patients medically. And then 2, if you're not a smoker, not a lot of people like the way that it smells. So again, close proximity to your patients, and you might exacerbate their condition if you just reek of cigarette smoke. I had a couple partners who smoked. They would always make sure they chewed gum. They actually had like a travel-sized mouthwash, hand sanitizer. They actually would wear gloves when they smoked too. So just a couple things to keep in mind if you do smoke. Guys, nutrition, we're not going to go back through the high school food pyramid, right? But just make sure you're balancing out your fast food with your greens, with your proteins, with your carbs. I cannot stress enough, stay hydrated. Try to drink as much water as possible. It will physically help you feel better. And because guys, if you start to get dehydrated or all you drink is caffeine and soda and you're not getting any water intake, we will learn through the human body and all this stuff, but that's not good for you. Your body needs water. So the better you physically feel, the better you're able to do your job, okay? Regular and uninterrupted sleep. What is that? I don't know. I have a 3-year-old and a 10-month-old. So again, I understand that that might not be an option for you, but just try your best, okay? Disease prevention, again, if you know, like through family history, that your family is prone to developing diabetes or high blood pressure or cardiac disease, then try to take a step back and be like, hey, I'm in the healthcare field. Maybe I need to try to be healthy myself, and just adjust your diet accordingly, your physical lifestyle accordingly, all of that jazz. Work, family, health, guys, you gotta have a work-life balance, right? Again, this cannot be all you do. If you've got a family at home, you need to make sure you're spending time with that family, with your friends. You're taking time for yourself. Just, you know, take time off, rotate your schedule. Don't work a week straight. Just make sure you've got time, if it's nothing else, to just sit on the couch and binge watch Netflix. You need some downtime, okay?
I've got a quick question about that. So if you're assigned a partner and you work like the same days every week with this partner, and then you gotta like take a shift off or maybe rotate your schedule or something like that, will they like assign you a new partner or?
So typically, if you've got a full-time partner, you guys both work the same shift and you're for the foreseeable future together as partners. If you have to take a day off here and there, then they just pull from, if you know somebody else's partner calls out, then they'll put that person with your partner just for that day. Or if you know you're taking like a week or 2 off, then they'll just temporarily place somebody else with your partner. And typically it works out that if you take a break or a vacation, you come back to the same shift to the same partner.
Cool. Thank you.
Everybody good so far? Okay. Communicable diseases. What is that? What's the definition? Contagious, right? Germs, bacteria, viruses that can be spread from one person or species, if you will, to another. Guys, we come in contact with a lot of that out there. Okay, there's a lot of germs, there's a lot of bugs and cooties that our patients might have. So this is going to move into the actually physically protecting us as best as we can with what we call PPE, personal protective equipment. So again, we talked about making sure you got your immunizations, using the appropriate PPE. Guys, wash your hands in between every patient, use hand sanitizer, just common sense stuff like that, okay? I believe we'll go over pathogen, contamination, exposure throughout these couple slides. All right, there's several different ways you guys can come in contact with these germs, all right? So we've got direct contact, indirect contact. So the biggest one we have with indirect contact is usually it means that we don't need to do it, right? We start an IV on a patient, which has to go through their skin, which comes in contact with their blood. If we don't properly dispose of that needle and we set it on the bench seat, thinking, hey, I'll get to it later, I'll throw it away later, and your partner comes in and sits down on that bench seat or goes to reach for it to throw it away, and that needle breaks your partner's skin, all right? That's going to be an indirect contact because it came in contact with the patient's blood. It's now come in contact with your partner's blood. What does that mean? Yeah. Whatever bugs were
Possible.
found in that patient's blood have now been introduced to your partner's bloodstream. Okay.
When I took like an advanced first aid class, and it was taught by Dr. Megan retired. He told us about this like drug that you can take if you have like been put in contact with a thing, and it's like a you can only do it within the first 72 hours. Do you know what I'm talking about?
Yes. The prophylactic step. Yeah.
Yes.
Yeah. We'll talk about that in a second.
Oh.
So again, with the direct contact, guys, that means if you don't have your gloves on, I have a really bad habit of like picking at my hangnails, right? So if I have any open skin or open wounds and I'm not wearing gloves and my patient's bleeding, or my patient sneezes, or my patient vomits, any of that bodily fluid, if it comes in contact with my open wounds, again, those bugs that the patient has now been introduced to me. All right, so just use common sense with this, guys. If you've got a patient, hacking up a lung, dispatch is telling you that they're coughing a lot, or you come on scene, that you notice that they're coughing a lot, you put a mask on and put a mask on the patient as well. Okay, bare minimum gloves, every single patient. We have other forms of PPE that, if they are available in an ideal situation, put them on, but some of the times we don't have them or we don't have time to put them on. Airborne transmission, okay, again, if somebody sneezes, if somebody coughs, those little droplets spread a ridiculous radius. Guys, have you ever seen like somebody, they did a scientific study, somebody sneezing, it comes out of your body at like 60 miles an hour and covers like a 20-foot radius, okay? So that's why mama taught you to cover your mouth when you cough, cover your mouth when you sneeze. But yeah, just be very mindful of that. If you've got a patient coughing, let's not get in their proximity until we both have the proper mask on, okay?
Is there equipment that protects eyes?
Protects what?
The eyes?
So technically, yes, we do have goggles, and they cover here and they go around the sides as well. They are available on the trucks, but it's just something that a lot of people don't remember that we do have, or they don't take the time to put them on, but yeah, they're there.
That's what I was going to ask about the safety glasses.
Yeah, so with the safety goggles, guys, if you wear glasses, it does protect the front view, but the safety goggles, we'll take a break. I'm gonna go get some of the stuff to show you guys. The safety goggles actually cover the sides as well, and typically prescription glasses don't have that coverage on the sides. Foodborne transmission, guys, if you get food poisoning, I guess it's possible to do that at work, but just be advised that it can transmit that way. And vector-borne transmission. What's the biggest example from?
Bed bugs.
Okay, so Lyme disease, who bite.
Mosquitoes.
Like West Nile.
That's not.
Oh, you were talking about illnesses. I thought you were saying the type of
Yeah, how it's what pandemic right now? Corona.
Yes.
Right, so that was transmitted from a bat to a person, okay, or the biggest, most recent research that they have. So yeah, we can get this species to species jump. The bubonic plague, right, the Black Death that killed like 1/3 of the world's population came from fleas. Those itty bitty teeny tiny fleas were getting on the rats, biting the rats, and then hygiene was not what it was way back then. And humans were getting bitten by the fleas and it was transmitting. So just be aware of these definitions, the different possibilities, and how we can protect ourselves against it. So again, guys, open skin, open wounds, and just a crazy sneeze, not good for anybody. All right, guys, again, wear your PPE. We're going to go over those again in detail, but make sure you've got your protective personal equipment. That's what it stands for on. Make sure that you're cleaning your environment, right? What else? If we've got a patient who's covered in blood, who's covered in urine, feces, emesis, which is the fancy word for throw up, any kind of bodily fluid, what all are they going to come in contact with?
the stretcher.
Okay, you got a stretcher back of your truck.
Equipment, clothes.
Right, so the sheets, the blankets on the stretcher, equipment, what kind of equipment? Yeah, anything you use on them, a blood pressure cuff, the cardiac monitor yourself. Like, guys, we should be coming in contact with these patients in very close proximity. You might brush with your pants leg while you're putting the belts on the stretcher. Right? So everything that your patient comes in contact with needs to be cleaned after the call. Even if they're not covered in blood, urine, feces, whatever. Even if they don't have any bodily fluids secreting from their body, everything that comes in contact with your patient needs to be cleaned. All right? You carry wipes. We can wipe things down. We carry some fluid. We can kind of spray on there and clean it off. Guys, you need to clean your equipment to the point that you feel comfortable using it on yourself. And that says a lot. All right, so make sure that you guys are actually taking the time to decon your equipment. If you've got soiled, soiled or anything like that, put them in the designated dirty laundry bins at the hospitals. Right? Don't just kind of toss them and say, "Oh, we can do that." You're cleaning it appropriately to the point where you would be comfortable laying on that yourself, or putting that blood pressure cuff on yourself. What's another thing that a lot of people overlook that we use almost on every single patient? Your stethoscope, right? You're going to use it to take a blood pressure. You're going to use it to listen to lung sounds or heart tone. It's coming in direct contact with your patient, so make sure you wipe that down after each call. Everyone should be super well versed on how to wash your hands now that we're in this current pandemic, right? There's been like TikTok videos and CDC's released stuff about you should wash it for 20 seconds. Make sure you get all the nooks and crannies. Use the antimicrobial soap if possible, and make sure you rinse very well, right? And guys, that's the #1 way to kind of decon your hands in between each call. Sometimes we might not have access to soap and water. All right. If you are taking a patient to the hospital, go ahead and wash your hands while you're there. If not, if you don't have access to soap and water, you can use the hand sanitizer. They've shown that it's just as effective. But soap and water is still the best way, because how is it different? How is washing your hands different from sanitizer?
The hand sanitizer really just smears the dirt. It doesn't get rid of the dirt.
It might kill off the bacteria, but when you're washing your hand, that friction is actually getting those itty bitty like microbes and, gross bugs off of your hand, and you rinse them down the sink. So you physically remove them. With hand sanitizer, it might kill them off, but you're not really rinsing it. You're not really getting them off of your hands, but they're just kind of still there. So again, guys, you'll see these are all over the hospital settings. We have them here in the academy. They might look a little different, but they're all the same thing. You can use it as substitute, but use soap and water if you have the chance. All right, and this is where I am unprepared. So we're gonna take a 5-minute break for me to go get this stuff for you guys, and I will be right back. So I'm gonna pause recording. You guys take 5 and I will be back shortly. All right, so notice right here, this container of gloves, I'm sorry, of wipes. We have these on the truck. You'll see them in hospital settings and ER settings and doctor's office settings. They have all sorts of unpronounceable chemicals in here that kill off all sorts of strains of viruses and bacteria and all sorts of the germs, okay? Please don't ever, ever, ever handle these wipes, or you might see a container with an orange top or a gray top. They are still very corrosive to the skin, okay? We have a term for these called cancer wipes. All right, if you handle them day in and day out without gloves, there are carcinogens in here. It will actually physically like mess with your skin, and they've been known to cause cancer. So much to the point, on the top of these wipes, it has a stick figure and a baby crawling around with a diaper say, do not use these on bare skin. It even says right here, not as a skin or a baby wipe. All right, so if you're gonna use the cancer wipes, these are really good to wipe down your equipment, your stretcher, your stethoscope, your blood pressure cuff, all that stuff. Just make sure you guys have gloves on and throw the gloves away, okay? Just, you're not handling this with bare skin.
Dumb question, but can you use those like on the ear parts of your stethoscope?
Yeah, just let them dry before you come in contact with your skin, okay? So, guys, the next slide, we're gonna talk about gloves, okay? Again, this is bare minimum PPE that you have on for every single patient. I don't care if they're bleeding or not bleeding, if they're complaining of a stubbed toe, I don't care what the complaint is, you have gloves on, right? Because that's gonna be the minimum barrier you have between your skin and your patient's skin. All right, you'll figure out what size you wear. Spoiler alert or word of wisdom, if you work a cardiac arrest or something, you're really, really hot and you're sweaty, or if you have these on for a long period of time, your hands will start to sweat. These things don't breathe, okay? If you have clammy hands or wet hands, you're gonna wanna put a size up glove back on because they will stick to your hands. It's gonna be really hard to kind of slide your normal size glove on, okay? So just word for the wise. All right, let me see your hands. Medium or large? Large. Okay. All right, so guys, we are gonna put these on when we figure out what size we wear for every single patient, and there's a very particular way we take them off. Okay, because why do we wear gloves? To keep us safe. From what?
Any kind of fluid discharge.
Right, bodily fluids, whatever it might be. So once we get them on, once they are soiled, right? I want you to touch the patient with them. Once we have blood on them, once we have ooeyes, secretions, whatever it is on our gloves, we need to take them off in a specific way to make sure we're not contaminating ourselves, right? So once they have blood or whatever on them, we're gonna take them off one at a time. So you'll start with one hand, and you can either pinch center right here, or you can try to get a finger up underneath the cuff. But just remember, if you've got blood on this finger, we don't want to touch our skin. All right, so I usually just kind of pull out the wrist cuff. You're going to pull up so it turns itself inside out. So that's the cool thing about these gloves is you can tell if they're inside out or not, right? So whatever blood is on the outside of that glove is now kind of self-contained, okay? So now we're not gonna let go of that glove I just took off. I'm gonna take it and kind of crumble it carefully not to fling any bodily fluids in this glove and do the same thing with this glove. All right, get underneath the cuff, pull it inside out and up. So now all of that ooey gooey stuff is all rolled up on the inside, and nothing out here ideally should have bodily fluids on it, and I can just toss it. Okay, so when you guys are in here for lab, you can practice taking them off the correct way, but just make sure you pull them inside out into each other every single time to avoid exposure from the outside of your gloves if they get contaminated. Okay, so that is that. There's a little step-by-step picture process of how to do that. Again, guys, you can pick up the goggles or the face shield or the goggles at your table. Notice again how they do have the protective layer up front, and then they have the widened protective plastic layer to protect you from the side. Okay, again, if you wear prescription glasses, you typically don't get that side protection. So these will help out with this. You guys can purchase these also like at Home Depot or Lowe's or something like that. But we do have these on the truck. If you want to get your own pair, that's fine. Go for it. Face shields. So again, guys, because where can we have contamination from anybody else? Through what on our body?
Opening.
So any kind of openings, right? All right. That includes all of the orifices of my body. Right? I've got what we call mucosal membranes that line the inside of my nose, the inside of my mouth, the inside of my eyes. All right, so if I get, bodily fluid on the inside of my eyes, it's eventually going to find its way into my bloodstream. Because of those mucosal membranes, it'll soak it up and it'll say, all right, passing you off to the bloodstream now, good or bad. All right, we take medications through mucosal membranes, or we can have exposures. All right, so again, if we got a patient who's just coughing up all sorts of stuff or is just throwing up everywhere, we want to protect all of those orifices on our face. So those goggles, if we have face shields, okay, that's a combo. We have a mask, it has a big piece of plastic that goes up and covers your eyes. So we're kind of covering all birds with one stone, if you will. We want to make sure all of our orifices are covered so we don't have that direct contact with bodily fluids. We have gowns. We typically, it's rare you'll see these on the truck. They're not standard equipment that we carry on the truck. You see these a lot in a hospital setting. These puppies can get hot too. They are non-permeable. What does that mean? Dang. All right, so yeah, in a sense, they're kind of waterproof. If we get any type of fluid on them, it kind of beads off. It doesn't absorb. It doesn't really come through to come in contact with our clothes or our uniform. If you do have those on the truck, I would highly suggest that you wear them if you're doing a field delivery, if you're delivering a baby in the field, because that gets messy. But like I said, we typically don't have them all the time readily available on the truck. These are more so the hospital setting. Okay. All right, everyone again should be super well versed on the definitions of different masks with everything that's going on, okay? So we will talk about the masks, because when it comes to healthcare, there are two different types that you need to know about, okay? Because what if your patient's coughing, and they're just all sorts of crap's coming up when they're coughing? What are we going to do? Just be like, oh, hey, can you cover your mouth, please? Yeah, I'm going to put a mask on the patient, right? But I have to put a very specific mask on the patient, okay? There are, this one's labeled as like a cone mask, but you'll hear these referred to as a surgical mask, all right? The filtration system, if you will, is much different than the ones that we put on ourselves. This is going to contain everything from escaping out. So if they're coughing up all sorts of phlegm and blood, it's going to contain that from getting out into my area, if you will. But what is it not going to prevent? Stuff coming in. All right, so what does that mean? Why is that important to know that this is the only mask that you will ever put on a patient? Repeat, surgical mask is the only mask you will place on a patient. Okay, because what does it not hinder?
Airflow.
Them getting oxygen in, right? It'll prevent stuff from flying out, like it'll contain that, but they're still able to breathe through this filter here. Very, very important, because if you're coughing up blood or coughing up phlegm, chances are you probably got some baseline difficulty breathing going on, right? Chances are we're probably going to need to give you some oxygen. But if I put a mask on that a patient can't intake that oxygen, I'm going to make it worse. All right, I'm going to make my patient worse. That is a surgical mask. These go on your patient. Everybody clear on that? Surgical mask, patient.
Yep.
All right, now on the other side, especially with the whole Rona situation, or like if a patient might have, maybe like meningitis or tuberculosis, I want to protect myself too. I'm going to place a mask on my patient, that surgical mask, but I'm also going to protect myself, right? This is the N95 mask that nobody can buy these days because all the supplies are gone, right? The infamous N95 mask. Why do I put this on myself? What does this do?
It filters out pathogens from.
Right. If I'm coughing up stuff, it'll self-contain that here as well. But the filtration system for this prevents stuff from coming in. So if any of that, airborne droplets is escaping my patient's surgical mask and is still in the atmosphere, if I have this N95 mask on, it's not going to be able to come through this barrier for me to breathe it in, get it in my lungs, get it in my bloodstream. Okay? I promise you, if you ever, maybe outside of the corona pandemic, if you ever roll into an ER with an N95 mask on a patient, even if they possibly have a communicable disease, that doctor's going to yell at you because you are preventing that patient from breathing in adequate oxygen. All right, always, always, always make sure to protect yourself. You place an N95 mask and the patient gets a surgical mask. You've got to understand that order. Okay, everybody good with why? And
What are the little, like, not fabric, but little paper masks doing?
those are surgical masks. So the ones that kind of look like a fan and they go from ear to ear, yeah, those are surgical masks. They'll kind of contain stuff, but you can still breathe in from that. All right, so everybody good with the difference? Cool. Where's my thing? All right, so this is conveniently the picture of a pocket mask or face mask that you guys are going to need for CPR day. Did everybody get the email I sent out during lunch?
Yes.
Yes, did everybody who said that on the email list?
Yes.
Sweet. All right. So
No.
no.
She sent
We
it
did
out
not.
during. You may have to check your email.
Yes, I just sent it during lunch. All right.
Yes.
Huh?
Yes, we got it.
Okay. So guys, the whole mouth-to-mouth resuscitation is not a thing anymore. That might be like a cheesy pickup line at a bar, but we don't do that as healthcare providers, okay? When you are on the job, on the truck, you will always use, if you're having to breathe for somebody, you're going to use this thing, okay? We don't even use these on the truck. This is just if you're a lay person, if you're off duty and you have this, this is the barrier device you're going to use to breathe for somebody. On the truck, this is what we use. This is called a BVM, a bag valve mask. All right, so this face mask right here, we place that on the patient's face. We'll talk about how to do that later on, but we use this bag right here. This will be connected to oxygen to squeeze the air into the patient's lung to breathe for the patient, okay? You will always, always, always use a barrier device. You will never, ever, even if you're off the job and you're at Publix and somebody collapses in there in cardiac arrest, you will never put your mouth on their mouth, okay? Unless it is like, maybe your kids or your parent or your spouse. If you're okay with swapping spit and you know where that spit has been, that's one thing. But for, for strangers, for patients, we don't ever use any type of mouth to mouth. I have to say this over and over again because, movies still do it. People still think it's a thing. It's not. We will use barrier devices, and you will be very fluent on how to use both of those in a couple chapters. Okay.
What is the acronym stand for again?
Bag, valve, mask.
I was gonna say, do we just need to get like the pocket mask, the part that goes over the face, or do we need like the whole bag?
No, just the part that goes in the face.
Okay, good.
All right. And guys, these are disposable, right? If you have to breathe for a patient on a call, this comes in contact with all sorts of stuff. We throw it away. It's not, we scrub it real good with cancer wipes and use it on another patient. So we'll talk about that in airway management when we get there. Sharps containers, these are really, really important to know what they are, where they are, and that you need to use them every single time you use a needle on a patient. Okay, so anytime you have a needle that comes in contact with your patient's bloodstream, you have to dispose it immediately the second you're done using it into that sharps container. It's got kind of like a one-way flap. Once you put something in there, you can't really go in there and take it out. So that way, all of that stuff that's come in contact with blood is not like open and available for your partner to sit on or to get one of those accidental needle sticks. Okay, so it's going to be red. It's going to have that biohazard label on it, and that is where your sharps, your needles, are going to go after you're done using them. Okay. Guys, if you do, because that is part of the risk of being in healthcare and being a first responder, is that there's a lot of things we can't control when it comes to exposure. So even if we're wearing gloves and we're wearing all of this PPE, it's still possible that we can have some cross-contamination between your patient's bodily fluids and ourselves. If that happens, know your local protocol for whatever agency you work at. You will probably have to finish out that patient call, that patient care, and then after the call's over, you usually get in touch with your supervisor and say, hey, I've had an exposure. We need to go out of service, which means they're not going to make you go run any more calls until you go through the proper protocol. Here at Grady, you get your blood drawn, all right? And with consent, blood is drawn from the patient. They take it off to the lab to see if the patient has anything that you need to be concerned about in their bloodstream. And then they just track your blood every 6 weeks, 8 weeks, if there's something that shows up in the patient's blood test, all right? If you develop or acquire whatever that patient had, then all of the medical care for that particular issue will be provided by your employer. But sometimes if we have a patient, say like if they have tuberculosis, they will go ahead and just start you on, like, it's pretty rigorous. If it's, especially if it's TB, it's like a 10-month long medication to kind of ward off, to hopefully that it won't like really settle down and you'll develop tuberculosis. Some places give like a prophylactic, like the viral prophylactic, but it just depends on your service. Okay, so just know your protocol if you have an accidental exposure. Talked about that. Again, guys, just make sure you're cleaning everything appropriately. If you have an exposure, especially in your eyes, try to rinse them with a fluid for about 20 minutes or so. Obviously, that's going to hinder your ability to provide patient care. So just get on the phone with the supervisor. Hey, this happened. I can't continue patient care. Let's get another truck out here to come take care of the patient, and then they'll deal with your exposure. Okay. Scene safety is really, really big. We'll talk about that in a few minutes. Hazmat, hazardous materials. There's a whole chapter dedicated to hazmat that we're going to talk about. Right now, you guys need to understand that if you have any inkling that you could have a chemical exposure, there's a fire at like a factory, or there's an overturned tanker that you're responding to for an accident. If there's any smoke, anything that has odors, any fluid leaking out, we need to confirm that our scene is safe before we approach that scene, okay? Placards that are on like the tankers or any type of container, this is gonna be your emergency response book, your ERG. you're going to flip and say, okay, what picture do I see? What number do I see? What color is it? And then that book is going to tell you, okay, this is bad, stay away, or hey, here's how to handle approaching this scene, okay? So we're not going to really jump into that right now, but do you understand? They actually have an app for this. It is free. It is great. I have it on my personal phone. You can type in the numbers you see, you can select stuff, and it takes you right to the page, and it tells you what's going on with that chemical. So I highly suggest you guys download it, but we'll get to that a little bit later, okay? Just other things to think about, if you have a car who hits a telephone pole or, you know, a power pole, and you have a live wire bouncing around, is your scene safe? No. All right, so that's part of your additional resources that we always need to consider, because it's not just additional advanced life support. It's not just a paramedic. It's not just fire. It's not just PD. Who would I use here? Or who would I call here? Yeah, call George Power. Be like, hey, dude, we got a down wire. Y'all need to get a crew out here and cut off the supply. Again, if we have a chemical, there's specific hazmat teams with the fire department. Hey, we need hazmat out here. You can call poison control. That's also a good additional resource. Just don't forget, you've got a lot of different departments that specialize in this stuff to make sure that your scene is safe, okay? Fire, again, guys, scene safety, #1 all the time, okay? Unless you just want to be the hero, if fire is not on scene, do not run into a burning building to get a patient. Why?
Because we're not equipped to.
Okay, so exactly, several reasons, but the biggest one is you are not equipped. If you don't have the training and you don't have the equipment, don't do it. All right, so what are some aspects of a burning building that might be detrimental to me wearing this?
The fact that that shit is not fireproof.
Right? This is not fireproof. All of their turnout gear that they wear is fire resistant. Okay, so they have better equipment when it comes to uniform. What else?
No oxygen.
Okay, structural collapse, right? They are trained to go in there and look at, you know, the support beams and is this building going to collapse? We don't know about stuff like that. We're not trained for stuff like that. What else?
Can't find the patient because you can't see anything.
Oh, chemicals. Okay, what don't I have on my face?
We don't have masks.
A mask, guys. Even an N95 isn't going to touch the protection that I need. Okay, they have. I don't know why I'm pointing. I have a laser pointer. All right, they have SCBA masks, self-contained breathing apparatuses. All right, that is connected directly to clean air. That is the only thing that comes in that mask. Not any of these chemicals that are, you know, released during the fire, not the smoke. They have equipment, they have training. All right, you don't run into a burning building. Guys, don't do it. I'm going to advise you, I'm going to educate you not to do it. But if you find yourself in a situation, I can't tell you what you're going to choose to do, but you got to know the risks and you got to understand your scene safety at the end of the day. Okay, so again, make sure fire's there. They have the equipment, they have the training. We don't. We need to wait for them. Talked about that. You used to receive extrication gear from Grady way back when. They don't give it out anymore. So again, if you're having to cut somebody out of a car, big pieces of equipment are used, sharp objects, metal, glass flying around. We don't have the equipment. We don't have the training. We let fire do that. They wear their turnout gear when they do that. They have the face protection. Their turnout gear, their leather gloves are not as penetrable as our uniforms are. So again, no equipment, no training, don't do it. Guys, these are just self-explanatory. You can buy your own leather gloves if you want some. We talked about the reason for the steel toe or the enforced toe. Just make sure you're wearing those. Dress for the weather. If it's gonna be hot, expect it to be hot. You can't really take off layers. That's not acceptable. Out in the field, if it's gonna be cold, dress in layers. If you are fair skinned, wear sunblock. But down here, body armor, again, In the 90s, they actually used to issue this to Grady employees as uniform because the gang violence was so bad. It is turned around. It's not as bad. It is not standard issue uniform, but I do know a handful of medics who wear their own vest to work. Kind of going into the, hey, we can't really control all aspects of our scene. Again, for anyone who has never worn one, they're very heavy. It's hard to breathe and you will sweat profusely. So if you're not used to it, I don't suggest it, but it is an option for you to wear your own underneath your uniform shirt.
Is it worth it? Would you say? Like, has it ever been useful?
Not, no, but the one day that they don't wear it, they'll get shot. You know what I mean? Like, it's just, it's your perspective if it's worth it or not. All right. Moving towards the mental. Everybody good with the physical? Dressing appropriately, PPE, being smart about your scene safety. Okay. So guys, you're gonna deal with a lot. You're gonna see a lot. You're gonna deal with dying patients. You're going to deal with patients who have already died, and now you're dealing with the family members. Okay. You're going to deal with patients who are really, really sick. You're gonna deal with patients who are complete jerks. There's a whole spectrum of the patient contact and interaction you're going to have with this job. All right. So you need to be prepared for it. A lot of this, all of this is going to come your way. All right. You're going to have anxiety from the patients, from the family members, maybe from your partner, maybe from yourself, right? Anxiety, pain, fear, anger, hostility. That's a big one. All right. Especially if, let's say, you're on scene for cardiac arrest, or a patient who we know it's not looking good, not really going to have a high chance of making it. If we are not doing our job quick enough, if we are not doing our job well enough, per the family members or per the bystanders, they get very, very angry towards us because we're not doing our job right. We're going to kill their loved one. Okay, guys, we will know that's out of our control, but those people don't. All right, so we deal with a lot of anger. Sometimes it turns into hostility. Sometimes it can turn into a violent situation. We'll talk about that later, but just know you're going to deal with that. And what's super, super important to remember about a patient who's angry at you?
We try to just.
So they might be scared. What'd you say?
They called 911. They're probably having the worst day of their lives.
Okay, so yeah, they're having a really bad day, right? But what else do we need to take?
To just try to disarm that, to not reflect that, to disarm that aggression, to not respond with, not fight fire with fire, so to speak.
Right, guys, we can't take, with a couple of exceptions, we can't take anything that these patients or family members or bystanders yell at us or scream at us, because guys, you're gonna get called names, I promise you. It might be racist names, it might be sexist names, it might just be derogatory names in general. When people are scared, they react with anger a lot of time. You can't take it personally. All right, because if you sit there and you become either offended or super, super angry and you start yelling back, what's that gonna help? It's not gonna help anything. Okay, again, there are some certain exceptions that it's not okay to have patients talk to you and use certain verbiage or anything like that. But for the most part, guys, you can't take it seriously. You got to kind of let it bounce off. Understand, they don't know you from Adam. They don't know your background story. They didn't call up 911 and be like, hey, is Savannah working? I want her to come to my house because I'm going to pick on her individually. You just
That's where that stress management comes into play, right?
Right. You just show up on the worst day of their lives and your attitude, your demeanor is going to drastically change the way that call is going to go, because I guarantee you guys, I had a partner like this who would get attitude back towards the patient, back towards the family members, and it never went well. On more than one occasion, I had to call PD out to our scene because they were getting into a verbal altercation. Don't ever fight back with your patient. Don't ever yell back to your patient. It will get you nowhere. And it can take you to the point where they're angry and we can cross that line and it can become violent. All right. So it might be hard to do, but they're not attacking you personally. They just might be having a bad day, or they just might be a jerk. Don't take it personally. Don't reciprocate.
What are the like exceptions? Because like
So now, if it's crossing the line of any type of like sexual harassment, anything like that, because unfortunately that does happen, or if it is just your patient's not drunk, they're not on drugs, they don't have a head injury, they're in their sound mind, they're just being a jerk, and they're repetitively calling you something extremely inappropriate, and you've told them calmly, hey, I don't appreciate that, please don't use that term again, please don't call me that again, and they're repetitively doing it. If it's getting to the point where they're harassing you, it's another case-by-case thing, right? Because we have the power to say, look, if you don't stop this behavior, if you don't stop that language, then I'm not comfortable, treating you, and we can go from there. We can get the cops involved. We'll talk about that in a little bit. But with certain exceptions, don't reciprocate, don't take it personally, just kind of keep doing your job and be as nice as possible. Okay, kill them with kindness.
Is there a case where you actually do refuse to pursue it?
Yes. But we will talk about that when we get to the legal chapter. Yes. Yeah, I've done it on a couple occasions. So guys, I can tell you kind of some common sense things. Don't say this to a patient, or maybe try saying this, but I cannot textbook say, if you have a patient who has a family member die in front of them, this is exactly what you should say. I can't tell you that. That's going to come with time. That's going to come with experience. And there's no right way to communicate with these terrible situations from person to person. That's going to change. Okay. So if the patient themselves is talking to you, because guys, I'm telling you, there is a sixth sense in these patients. They know, they get that gut feeling. It's called the sense of impending doom. They know when they're going to die. And if they are coherent, they're going to tell you, don't let me die. And those might be the last words that you hear from that patient. Okay. So if you're communicating with a patient and you are not feeling good about the patient's status and they're starting to talk to you about that, you need to believe them. I'm not talking about the dude who stubs his pinky toe. And he's like, oh my God, I want to die. It hurts so bad. Clearly we're being dramatic there, right? But if you've got a patient who's unstable, and they're starting to get that feeling and you're not feeling good about the overall status of your patient, don't just brush it under the rug. It's like a sixth sense thing that kicks in. Trust me, I've been there, done that, and it sucks. All right, so avoid sad or grim comments. What do you think is not a good thing to say to a patient who you're pretty sure is not going to make it?
Oh man, it's not looking good for you.
Yeah, dude, it's not looking good. Sorry, but have a
How's your life insurance?
last 5 minutes. Like, I mean, we don't want to give false hope as best as possible, right? But we don't want to be like bluntly honest and be like, yeah, dude, no, you lost too much blood. You're probably not going to make it to the ER. See you on the other side. Right? So be honest as best as possible. You can say, hey, I am going to do everything I can to help you. All right? I'm going to do everything I can to get you through this. You're not lying to them, but we're just kind of omitting some truth when it comes to that. Okay? Allow for hope. I mean, you see like the war movies where the scene is, they're talking to their fallen comrade or something, and they're actively dying, and they're talking about, oh, you're going to tell them when you get home. Or if they get to that point and they're losing that lucidness, then sometimes we do go there with the patients. But just try to have that balance between honesty and not brutally honest, if that makes sense. Guys, kids, nobody, you can be in this career for 20 years. Nobody ever wants to deal with a sick kid or a dead kid. It is, I don't care if you have kids or if you don't, it's just not something that you want to deal with. Obviously it's a tragic event. All right, be mindful. If you don't have kids, let's see. I think this is in the communicating one. If you don't have kids, don't try, or if you can't empathize, what does empathize mean?
Empathy is understanding what someone is experiencing.
So you can personally relate, right? I have empathy with anybody who tears their ACL. I've torn mine. I know how bad it hurts. If I have somebody who has ACL, I can literally say, I know how you feel. This sucks. I'm sorry. I know it hurts, right? But if I have a patient who's ever had a pneumothorax, I don't know, a collapsed lung, or has been shot. I've never been shot. I can't say, hey man, I know how you feel. This sucks. But I can still have sympathy for them, right? What does that mean? I have compassion. I've never been shot. I don't know what it feels like, but I know it's gonna suck, right? So I can still feel compassion for them. If you've never been through exactly what this patient's been through, don't say anything like, I understand what you're going through, all right? Because that can make people get angry quick. So, again, guys, you're going to come across people who die. Whether you're working that cardiac arrest or they're already dead, we know we can't do anything about it, and then we have to deal with the family. Understand there are 5 stages of grief, okay? It's textbook with the 5 stages, but it's never textbook how people will react to grief, okay? So keep that in mind. Denial, this is they're not accepting the fact, oh, no, they're just sleeping, they're gonna wake up. Okay, when we know that they don't have a pulse, they don't have a heartbeat, they're not breathing, you know, it's not just they're taking a nap. Some people don't, it doesn't register that they're actually passed on and not, you know, just sleeping. Anger and hostility. This is probably the biggest section that we deal with, okay? Because again, we come on scene, guys, it's never a pleasant experience to lose somebody you love, ever, right? So if we come on scene and in our medical minds, we know there's nothing we can do to save this patient, we're still gonna go through the process of it, just, you know, because that's what we do. You can't tell a family member that we're doing everything we can, but we know that we're not gonna save them. Like, they won't accept that answer. They're gonna look at you and they're gonna need something to blame, and you're gonna be it. Man, you don't know what you're doing. Man, you're not working fast enough. You're not moving fast enough. And they're gonna get angry at you because they're dealing with the emotions that their loved one's probably not gonna make it, okay? So this is the biggest one that we probably come in contact with as a first responder. Again, remember, don't reciprocate. Use kind of phrases like we're doing everything we can. Sometimes you have to reason with these patients or the patient's family members, right? Instead of yelling at them or arguing with them, you need to take a step back and say, look, sir, ma'am, I understand that you're upset, but if you don't let me do my job, I can't help your spouse. I can't help your mom. All right, I've had to do that several times because they're literally getting in my way and preventing me from doing, you know, working that cardiac arrest. And sometimes if you just have a level-headed conversation like that, then they will understand, oh, okay, I'll back off. All right, but again, don't yell, don't cuss back, because that is absolutely going to go south very quickly, okay? Bargaining, you know, oh, I'll quit smoking if you bring them back, or I'll quit drinking, or I'll do this, or I'll do that. Depression, this is when it really kind of sinks in that daily routine, that daily interaction with that person's not going to be there anymore. This is where we see the very, very sad withdrawing from kind of like their personality or the reality around them. And then acceptance, okay? When might we come across acceptance in the healthcare field as a first responder when it comes to grief?
Hospice response.
Up to the patient, be like, do you accept? Are you happy with the outcome? Okay, so maybe, but what's another situation?
After losing the patient, maybe the next day after some period.
What was the question?
Okay, so in real time, we get dispatched to a cardiac arrest. All right, maybe we go out there and we figure out there's nothing we can do for this patient. What might be a situation where we are seeing acceptance from the family members, like they're totally okay with their family member being gone?
If someone has basically had multiple heart attacks, or this is something that was a long time coming, maybe.
Okay, so we might experience the acceptance stage. Guys, I watch way too much Dateline and true crime stuff. So they've either murdered their significant other and they're good with it because they're about to get the compensation check. Just kidding. Or we've had somebody who has had like a long-term illness, like maybe a cancer patient who has been in stage 4 cancer. They've known this time is coming. They've had their time to spend with their family, to say goodbye. And now they've accepted that this death is going to happen. And it's almost sometimes a sense of relief because they know their family member is not hurting anymore or is not sick anymore. Okay. So we're typically going to see the anger and the acceptance. Okay. Sometimes we'll see the denial, but we see the anger a lot. So just understand how to not reciprocate with this. Okay. So here's a chart. Again, I can't tell you say this every single time and it'll work. All right, that's just going to be you being a compassionate person, having a conversation with a human being, right? Try to say, you know, I'm sorry for your loss. It's okay to be angry. You know, if you want to cry, it's okay. For the love of Pete, don't say some of this stuff up here. Guys, this stuff is up here because I guarantee you somebody somewhere has said them, okay? You should not question God's will. No, don't want to hear that. I promise you, coming from someone who has kids, if you deal with the death of a child and you tell that parent, oh, it's okay, you can have another one, I would be in jail for attempted murder if you said that to me. Like, I promise you, like, you would become a patient. Don't ever, ever say that to someone who just lost a child. The living must go on. You're not the only one who suffers. You got to get on with your life, guys. Hopefully, to everyone out here, that's common sense, that that's not things you need to say to somebody who just lost a loved one, okay? So, guys, just, if they need to cry, if you need to hug them, go for it, all right? You got to have compassion to thrive in this career. So it's okay to have that interaction with the family members, because if we know there's nothing we can do for this patient, our patient's now the family, right? We can console them, we can talk to them, we can be there for them. That's totally okay. That's totally appropriate. Again, guys, just make sure you know your body, you know that you're getting stressed out, you know your stress levels are rising. There are physical things that you might feel that you didn't know that are stress manifesting in your vital signs or in your body, right? Your heart rate might increase. Your blood pressure might increase. You might get maybe a headache because your blood pressure is so high. You might hear some ringing in your ears. You might have like some visual disturbances because your blood pressure is increasing. You might have just like cool, clammy skin. You might have a little bit of sweat on your skin. Your pupils might dilate. We'll talk about that a little bit later. You might feel tension. Like if you ever just notice, like if you're standing, how your muscles are tense, and you're like, oh man, like my shoulders and my neck, I do it all the time. I'll like take a second and be like, ooh, I need to relax those things. All right, so tense muscles, increased respirations, you're breathing faster, your heart rate is increasing. These are secondary to a hormone that gets released in our body when we experience stress. Anybody know what that is? Okay, so cortisol, that will go to the increased blood glucose level, yes. Adrenaline, okay, epinephrine, all right, that is our body's response to anything that we perceive as stress. We start to get adrenaline or epinephrine in our bloodstream, and it causes these things to happen. All right, so if you're noticing, man, I feel like my heart's beating really fast, or it's, you know, beating out of my chest, take a step back and be like, ooh, maybe it's because I'm stressed out. Okay, so we can have these physical manifestations of stress that we need to take note of. Guys, there's a ton of stuff that can cause stress. If you've got multiple patients, if you're dealing with dying patients, this is a big one. Overpowering sights, smells, and sounds. There's some non-savory smells and things that you'll hear that will stick with you, and it doesn't make it a pleasant work environment, okay? talk about that in human body. I think this is the last thing we're going to talk about here. PTSD. What is this? Post-traumatic stress disorder. Okay, this is a real thing. What's happening with PTSD?
You're constantly recalling an event in your mind.
Okay. Yeah. So most of the time, you hear PTSD related to who?
Military.
Veteran, right? Guys, I cannot do what they do. They have got a whole different set of components to go out there, especially if they see combat, you know, to actively be killing people and seeing their friends dying. That's heavy. All right. So typically with PTSD, you hear it more so referred to with combat veterans, but it's a thing with first responders, right? You see something or hear something or go through a traumatic experience, whether that's you see somebody dying on the front lines of a battlefield or, you know, on Marietta Boulevard, okay? And that either consciously or subconsciously gets you to the core and it bothers you, all right? You might not think about it on a day-to-day basis. You might not even understand that it's really affected you the way that it has until, you know, some time has been removed from that particular event and you hear something or you smell something or, you know, there's something that reminds you and takes your brain back to that event. And you
subconscious triggers.
Do what?
Subconscious triggers.
Yeah. All right. So a big one for combat veterans is like fireworks. All right. Fireworks can sound like gunfire. It can trigger them to go back to that traumatic event that they witnessed in the field. All right. In healthcare, you know, like particular odors can just make you go back to that. Particular, you know, a song that was playing on the radio right before you got dispatched to this call, you hear it again and it takes you back. And you have these anxiety attacks, these panic attacks, because it's your brain's way of trying to process all of that bad stuff that you saw, okay? So this is for combat veterans, but it's also relevant for first responders because, guys, we see everything raw, right? We don't see these patients bandaged up and sitting in a hospital bed. We see it in real time. We see brain matter on the floor. We see decomposition. We smell decomposition. You know, we see somebody, you know, beating their kid, whatever it is. Like, we see this stuff in real time. So I'm not trying to compare what we do to being, you know, in combat, but it is still similar when it comes to the trauma, okay? CISM, critical incident stress management. This is here. Grady has it. Every agency should have it. If you go through a terrible call, right? There are people who reach out to you or who are available if you reach out to them to talk to you about it. Kind of have just like a debriefing session, talk about it, see if there's anything that's, you know, if you kind of vent, it'll get off your chest, give you some coping methods type thing. So that is out there if you want a really, really bad call and you just can't shake it. We can utilize that here at Grady and at other agencies as well. Again, guys, know yourself. Know when you start to show signs of being stressed, loss of interest at work, increase of drugs and alcohol, indecisiveness, you can't keep your mind straight, you're overreacting, like, you know, being very irritable to people. Just understand that that might be stress manifesting in you, and you might need to take a minute, maybe take some time off, do your thing, decompress. Okay. So again, guys, it is not unheard of that a situation can turn violent for us. Again, guys, always try to do what first? De-escalate. What does that mean?
It means the opposite of escalate.
Right.
Calm things down.
Right? If you're picking up real bad vibes, this patient, or whoever's cussing you out, have a level-headed conversation with them. Don't cuss back. Try to, without saying, hey man, calm down, because that doesn't usually go over very well. Just try to have an educational moment. Hey, I'm trying to do this. If you let me do this, then I can take care of you. Hey, you called me out here. I would love to take care of you. I would love to make you feel better, but I can't do it when you're yelling at me. All right, so try to calm the situation down. Don't reciprocate. Just always, always, always try to de-escalate first, because if you come out with guns blazing and say, hey, you know, buck up and you're ready to fight back, I guarantee you it's going to end up badly. You're going to need PD out there, and your patient's going to try to, you know, beat you up. So be careful with that. Try to diffuse the situation. Guys, there are several different reasons that patients could be acting erratically, could be cussing you out. It could be because they're having a psychiatric episode. It could be because they're drunk or intoxicated with or inebriated with any other type of drug. They could have a head injury that's making them act abnormally. Their sugar level could be low. Their oxygen level could be low, or they could just be a teeny total jerk. All right, so again, are you really going to get anywhere if you're fighting back with somebody who's calling you names because their blood sugar is low? No. All right, so remember that there are several different reasons a patient could be acting like that towards you. Cultural diversity, workplace issues. Let's see. Sexual harassment. Again, guys, it is everywhere. Again, if you get these harassing comments or you know, unwanted advances from a partner, from a coworker, from a patient, it's not okay. All right, so again, have a conversation, especially if it's a patient. That's not okay in my book. Don't say that again. Don't try that again. If you do, we're gonna have a problem. You can be assertive and you can be firm without being a jerk. All right, same with coworkers. You know, HR is there for a reason. Talk to supervision, stuff like that. It's not okay. All right. Don't come to work high. Don't use drugs in the back of an ambulance while on shift. Okay. Again, guys, just make sure with these issues we're talking about, this PTSD stuff, just make sure that you're talking to somebody. Don't let it build up until it gets to the point where it's not a good outcome. Okay.
Question: Will we have to deal with that? The whole drug issue? I mean, is that a real reality?
So I specifically said don't use drugs in the back of an ambulance while on shift because it's happened.
Okay, and so in that instance, when let's say, you know, because we're basic bitches, so it's like, you know, let's say it's a superior, someone who's a who has higher up in the hierarchy. How do you know? How are we supposed to handle that? Or how has that been handled in the past?
I don't care if you're the director of Grady. If you shoot up in the back of an ambulance, it's a problem. Yeah, because
I get it, but I mean, how do
right. At that point, we've got a problem with work ethic, right? That's not okay to do on the job. But also, what do we have?
Safety issues, like, I mean.
Maybe a safety issue, but maybe now we have gained a patient, right?
Oh, okay, yeah, gotcha.
So yeah, we'll go into healthcare provider mode first. If they need any medical assistance, we're going to do that. It's just something you're going to get on the phone with supervision or over the radio. Probably maybe a landline, because everything we say over the radio is recorded, and say, hey, this just happened. I need some help and you need to be aware of it. You can only follow the chain of command and report it to your supervisor. Whatever they do with that is now in their hands, but you have to make sure that you do the right thing by your ethics and your responsibility as a patient care provider. Okay, so yeah, because guys, even if you've got a bang up partner, you guys are close, you're a good team, if they show up to work either still drunk or they're shooting up drugs, you can have a conversation. Hey dude, I know what's going on, go home. Because guys, it's not safe to work with somebody like that, right? Or, you know, if you don't like them or whatever, you can like call supervision and tell them what's going on. But in any capacity, you've got to deal with the issue. It's not okay to be doing that at work, and it's not safe, and it can't happen. So Grady does have a random test policy. If you are exhibiting signs of, you know, you're constantly being late to work, you know, maybe drugs are constantly going missing on your shift. If they have kind of like probable cause, then they can say, ooh, hey, pop quiz, go pee in this cup. But fun fact with Grady, if you're driving Even if you're not driving, let's say your partner's driving you guys to the hospital, you've got a patient in the back, you're in the back providing patient care, and somebody runs a red light and T-bones you guys. That's a vehicle contact. It doesn't matter who was driving or whose fault it was, you're getting drug tested.
Yeah.
If you drop a stretcher or do anything that causes any type of incident with involving a patient or Grady company or Grady equipment, you're getting drug tested. So you might think that you can like control your habit and not, have these signs and symptoms that you are using and abusing, but it doesn't matter. You could be doing absolutely nothing wrong and somebody else sideswipe you or something like that. You're still going to get drug tested and you can get busted that way too.
Aside from like the drug stuff, if someone does hit you, it's like definitely your fault, and you're the one driving the ambulance, then like do you get in trouble or like what happens?
So we have drive cams in the front of the truck. They monitor outside view and inside view. So as long as you weren't texting while you were driving or doing anything that violated Grady policy and it truly was somebody else's fault, you're fine. But a lot of people get fired that way because they don't run into somebody else runs into them. But while they're sitting there, they're texting or doing something they're not supposed to be doing, and the drive cam catches it and they get fired. So remember that whole character is what you do while no one's looking thing. Yeah, make sure you guys utilize that. Questions, comments, concerns? Everybody good? Guys, I'm so good with this recording thing. Look at me go.
Yeah, good.
I'll